You ever felt really tired or noticed changes in your weight or mood without understanding why? Or maybe someone you know is going through strange health issues and you're trying to figure out what's going on. What if there was a way to unlock the answers to these health mysteries? Imagine a place where you could find solutions to questions about things feeling anxious, losing hair, or not having energy. Well, get ready, because we're about to explore the secrets of thyroid health. How is hypothyroidism diagnosed? It can actually be difficult to diagnose hypothyroidism because the symptoms can be easily confused with other conditions. If you have any of the symptoms of hypothyroidism, talk to your healthcare provider. The main way to diagnose hypothyroidism is a blood test called the thyroid stimulating hormone TSH test. Your healthcare provider may also order blood tests for conditions like Hashimoto's disease. If the thyroid is enlarged, your provider may be able to feel it during a physical exam, during an appointment. How is hypothyroidism treated? In most cases, hypothyroidism is treated by replacing the amount of hormone that your thyroid is no longer making. This is typically done with a medication. One medication that is commonly used is called levothyroxine. Taken orally, this medication increases the amount of thyroid hormone your body produces, evening out your levels. Hypothyroidism is a manageable disease. However, you will need to continuously take medication to normalize the amount of hormones in your body for the rest of your life. With careful management and follow-up appointments with your healthcare provider to make sure your treatment is working properly, you can lead a normal and healthy life. What happens if hypothyroidism is not treated? Hypothyroidism can become a serious and life-threatening medical condition if you do not get treatment from a healthcare provider. If you are not treated, your symptoms can become more severe and can include developing mental health problems, having trouble breathing, not being able to maintain a normal body temperature, having heart problems, developing a goiter, enlargement of the thyroid gland. You can also develop a serious medical condition called myxedema coma. This can happen when hypothyroidism isn't treated. Will I have the same dose of medication for hypothyroidism my entire life? The dose of your medication can actually change over time. At different points in your life, you may need to have the amounts of medication changed so that it manages your symptoms. This could happen because of things like weight gain or weight loss. Your levels will need to be monitored throughout your life to make sure your medication is working correctly. Can hypothyroidism be prevented? Hypothyroidism cannot be prevented. The best way to prevent developing a serious form of the condition or having the symptoms impact your life in a serious way is to watch for signs of hypothyroidism. If you experience any of the symptoms of hypothyroidism, the best thing to do is talk to your healthcare provider. Hypothyroidism is very manageable if you catch it early and begin treatment. Are there any foods I can eat to help my hypothyroidism? Most foods in Western diets contain iodine, so you do not have to worry about your diet. Iodine is a mineral that helps your thyroid produce hormones. One idea is that if you have low levels of thyroid hormone, eating foods rich in iodine could help increase your hormone levels. Do not try any new diets without talking to your provider first. It's important to always have a conversation before starting a new diet, especially if you have a medical condition like hypothyroidism. Foods that are high in iodine include eggs, dairy products, meat, poultry, and seafood, edible seaweed, iodized salt. Your food is your fuel. Making sure you are eating foods that will help your body, along with taking your medications as instructed by your healthcare provider, can keep you healthy over time. As we finish Nina's story, we've seen how hypothyroidism affected her life. We explored the details of fibroid health, learning about symptoms, diagnosis, and how to manage it. Nina's story is just one part of many health experiences. Everyone's journey is different, and there's always more to discover. If you or someone you know relates to Nina's story, or if you want to learn more about health, consider subscribing. Subscribing means you get more information, updates on the latest medical insights, and stories of people overcoming challenges. It's about staying informed, connected, and feeling empowered on your path to being well. With the subscription, you can access a lot of helpful information. Join a community that cares about health and well-being. Subscribe now and be part of a group dedicated to understanding health better. Your journey to a healthier life can start with a simple click. Subscribe today.